We'll take a critical look at the Auditor's General report on COVID-19 now. You will see clear thievery. Sir, the way it is clear and it is evidence to say it's here to 2 years. Now, the Auditor General reporter, violation without approval. That is the 81 point. Section 87 of the Public Procurement Amendment Act 2016. Act 914. It provided pefe acquire your first one. Your contract. Any kwanya your first one, your percentages in Nasifo Yinano, ye disperse no. But Oba say one, this is not my focus. I say, contrary to the approval and the provisions above, we observe that the ministry, without approval of the Central Tender Review Committee, we observe that the ministry, without approval of the Central Tender Review Committee, increased the cost of 5 contracts without contracts with a total contract sum of 24,256,500. So, look at the difference. Look at the variation difference. 24 million by 4 million. So the original amount was supposed to be 20 million, but I want the 4 million extra money at the car through variation order. It is also, you see the breakdown, which tells you clearly, say, but who, why, and the pressure, me a the panel. Why the pressure? Emi aya de pano. Se eso bi hwe ne aya de pana, eye wan e de se hwe. In the Auditor General report, as cited say, the Central Tender Review Committee increasing the cost of 5 contracts without with total contract sum of 24,256,500 by 4,017,000 through the variation order. Am I want to say no? Everybody saying the question is why? What happened? What happened? A very simple observation. Now, me person who knows how they will have to say. Person who knows how they will have to say. A had a member ye mwa show. Say ye share ye niema, baby ye to ye sika edia gua. Now tie. Bravo. Insurance companies are hodwa. Ye dey insure the frontline workers. Now tie. General principles of insurance requires that when an employer or an organization purchases group life insurance policy to cover employee in case of death, accident, temporary or permanent disability, and critical illness, the employer or the organization may keep the master agreement. But the identified employee should receive certificate coverage which could be used by the beneficiary or the next of kin to apply for the claims needed when the need arises. A person can say me and ya de be ababesi anu mu say ekoba say bibi etumia enam say company na ye insurance policy di ama me nti enya me enam be benefit but e bom ni pa be de na si manan and a benefit. It is any partner medina simanano enya me madwuma na mbaye ye no and na me crisis na me go through onya ho faso na ye conform mo hwe de ye pa because there are a lot of insurance companies koya gina bra from kakra. Now so this is what it is. We observed that this is the Auditor General report and Kasayo. We observed that the ministry paid 10,309,919.94 pesos as premium for special life insurance cover for 10,000 health workers. Tio, for 10,000 health workers and allied health professionals working on COVID-19 pandemic without any life insurance policy detailing the beneficiaries. Eti nyabazo child say yakwa ko chesi kade di ato and there are various insurance companies but nipa na no be benefit from the insurance and the insurance policy no sa nipa kro no ye hu no for over 10,000 health workers. So we were like, okay, we insure frontline workers and allied health professionals. Agreed. But those people now, you see, insure, they are nowhere to be found. They cannot be identified. Over 10,000 of them. Now, so this is the breakdown of Enyema Eko. So the beneficiaries, their location, their next of kin in case of death, nature of the benefits and the terms of coverage Nina were not identified, but the health ministry paid over 10 million Ghana cedis to cover 10,000 people. But whereas Nipakrona on benefited from the insurance, Nipakrona details to Krabona, I said young fan say okay, so insurance in the bar quite bad the modalities no and also cry insurance companies non kasa how the insurance package is all about. The insurance company do not even know the full package of the insurance cover. And they could not give details of the beneficiaries. They could not even identify where they were. Nipa obedi na dear. In case of service, a woba, Sandy Pacono, yet me identify. Nenso the health ministry, Aquacutia 10 million Ghana cedis, Nedia to one say, more for my insurance companies. No. Now, so more share. This is the breakdown. Enterprise Life Insurance Company, or no, the highest. My dear. Mutio Enterprise Life Insurance Company Limited. My dear. So now insurance companies are. You first of all consider the state-owned company first. That is the SIC. Now look at where SIC is. It is the percentage. Enterprise Life Insurance 30%. He got the highest. Meanwhile, a private business media. And at the state-owned enterprise, as I said, the state-owned insurance company, no, 20%. Enti odika agene de akese. No wia or the kumano de ama omano na omano enya sika kitua bi no no mom enya dodo na. So the Enterprise Life Insurance Company enya 30% co-insured. That is the highest one of all. It's yetia 10 million Ghana cedis to Tuwarumo. Enterprise Insurance enya 30% of the 10 million. Say ya de Tuwarumo na ekobase obi ho kan nipa so hwe na ye hu no. What the common say? Nipa no kra ye ni details ye ni dibia ni nkrata de so nipa na ye se ne ho koba asem a ye hwe nipa kra na ye hu no. Now number 3, Glyco Life Insurance Company Limited, enya 15%. Star Life Insurance Company, enya 7.5%. Holland Insurance Company, enya 5%. Ghana Union Assurance Life Company Limited, enya 5%. Life Insurance Company Limited, enya 5%. GN Life Insurance Company, enya 5%. Alliance Life Insurance Company 5%. Ghana Life Insurance Company 2.5%. Now, so Kesian Nankasa de Enterprise Life Insurance Company 30% of the 10 million Ghana cedis. But the Auditor General report is also actually say. How much I say? They insured the ministry paid 10,309,119.4 as premium for special life insurance cover for 10,000 health workers and allied health professionals working on COVID-19 pandemic without any life insurance policy. Without any life insurance policy document detailing the beneficiaries, the allocation, the next of kin in case of death, and the nature and the benefit of that insurance. But yet, it's how they will. The Auditor General report, Abba, Sadia will hold 10 different 10,000 health workers. But Abayno Bekaye, and I remember. One of the fellow Ghanaians address. On my pain and out the Danko for the catch there, say, on my insure over 10,000 health workers. Probably, but majority of the health workers, frontline workers, no, were not insured. They are not even aware of this package called insurance. This is the level of scammer the Auditor General reports. It be identified. So you see clearly say something is wrong somewhere. Now, Tobo, there is one aspect of this very, very particular reporter. It will shock you. It will break you down. Sure? The way and manner you use your name. The health minister Becca said in the midst of the COVID, now the way pressure see what so and as if or drilling crana. So he wasn't thinking straight. So he would just approve, release this money, go somewhere, release this money. On him. Sure. There was a financial agreement on Ghana COVID-19 emergency response project signed between the Republic of Ghana and the International Development Association 2020. Number 6602GH requires the COVID-19 management team to put in place measures in strengthening the containment, isolation and treatment, including leasing, renting, and reversing the designated facilities and centers to contain and treat infected cases in a timely manner. How do I issue the one? How do I issue the one? Now, come here, conform. Now, get me the leasing agreement. Mami, the leasing agreement. Ya tumia ya manejia bubo kronwa ma enyama kiti bi esi yede esa ye hono. We are not getting those things because of the level of scammer ekoso e ha do say. No, oko wedim bra. Mami, the leasing agreement. You will observe sir. Adia kitwe bi na kesi ye de yantimi anye eti amaye akasa no yeah. So you will understand. Sika say ye de insurance e de ma 10,000 health workers. Ye insurance ye hwe omo say insure mo na ye hu omo. Insurance companies dey ma ji sika de ato ho. Insurance companies no agisika no enya to ho. The enterprise insurance company enya emu 30%. Ena SIC state insurance company enya 25%. But those 10,000 health professionals and allied professionals now. We don't even know their details, who is the next of kin, and any of their vitals. But they are just got their mouth. Now, in one of the leasing agreements, you are renting it for 25 years. This is the whole story. You are renting a field for 25 years. And now, Ghana Basa, you are renting a field. You bet you have 15 million, over 15 million Ghana cedis. You are renting a field 25 years. Now, so this is it. Ministry, the Auditor General HSA, we observe that the ministry entered into a 25 years finance lease agreement with QHC Projects Limited at a total lease value of 15,265,000 in April 2020. That is your current a year for 25 years. I bet costing 15,265,000. The underlying assets were uncompleted building Iowa Adakulu. It's a uncompleted building for 25 years. I yet 15 million Ghana cedis. Edema, Nipana Dane just because a uncompleted building here isolation center. Namunte near womb. Adakulu, the Volta region, were managed by the QHC Project Limited. The buildings were to be used as an isolation center during the peak of the COVID-19 pandemic. We noted that the ministry could not use the facility for the intended purpose. And it's therefore, for the intended purpose, and therefore remodeling the building at an additional cost of 382,246 with out of the 30 million that had been paid. I'm rented down 50 million. No, I'm the country 30 million added to Honomo. It's yeah remodeling na remodeling tetio. Ya said that the brofu kese bi na dey say remodeling. Yeah renovating a dino. Na yamana ye into full complete building for an intended purpose. No, it cost Ghana 20 million. 20 million Ghana cedis. Over 20 million. No, meanwhile, a then nankasana ye kokwaje ye no was just 15 million Ghana cedis, which was an uncompleted building. For 25 years, you had 20 million Ghana cedis at the Maakye renovation. This is the country we have. This is the report. This is the Ghana we live in. And therefore, it is so funny, very pathetic. But the issue is that in the midst of all this, who is watching the watchman? Who is watching the watchman over all these things? In the Auditor General report at the Aba, why the BBA, why the fund is everything, recommendations, everything. Now ask yourself, from 2022, our reports in the buyer till now, Action Bay, and Omwateki, to making sure that Ghanaians would have value for its money. Now, the interesting and the sad aspect, the interesting and the sad aspect of it is that your check COVID-19 levy, so say, will be entry 1%. Sikadi yadio, yadi sikano, yadi 50 million akoko rente uncompleted building. 25 years. You say renovation, you remodel a dino, and no cost you more than 20 million. You find Yajuma, you Jadano, you see one of Nadana Bosom. It is said last year, you call Nanada Goku no more coin of Gobuza, yeah. Kwakwaji ma edu ko onu ma no ko gusa hwe etisi adan na kawura ma ye hu ne ye mfa edan no emfa nye but we have already paid 30 million out of the 50 million Ghana cedis and they did 20 million and they are remodeling and say renovation ye ko boss because edan na kasa it wasn't in the best of its shape. Therefore it is now koto ade na so hum say Covid-19 levy 1% that's why. Now no sika no mudi ye no. Eno na wutua no. Sisi akwa koto nsuo just sachet water cry na you're going to pay that Covid-19 levy. You better was yami adu watch now. You better was yami adu watch now. So uhun yama bi that say say Ghana ni start say or come say Covid-19 levy ye pese betua and na taxes ahodo ne doso na manyone ne ka kire wo say da bi chichire so wutua you should know say sika no wadi awie na kadan enye completed enye completed and wakwa rente and as be complete and now this sika more than a dan now the kwakwa shame uwie ya o say dan so kura da ne isa me de ye no me fa nye kura me jada na so ba na sa pro Nieti ha ni ehwe obi. Nieti ha obi da so di minister. Nieti ha obi da so edi the position, edi di me. Edi Covid-19 levy de mo fa hye mutrim. Ye be koso etua because Eskado munya ntete ka nwie. Omunya nwie o. Omutete ka nwie ye de bekoso atua. Bear in mind and have it at the back of your mind say Covid-19 levy no ye nya atua na enya atua okira because ye di sikada wie Covid is so a ye hwehwe Ghana ha ba bia ne say Covid na wo hefa ye hu Covid no. Ghana ni minimba bia wo Covid and when your Covid be isolation centers now here can what is the use of the isolation center now? Sikana yedi ejuma na yamfanye but Ghana ni e dey try. So sometimes when we tell you the ordinary Ghanaians say and niema bi wo hodom you should be guided but be mindful what is a sabio Ghana ni mpewasem and nasa say joining mpewasem because of your political affiliation. No way. It is not just about your political affiliation. It is about the management of the economy and making Ghana a better place to live. Abana jwe so ya say abana metiska chef fashion mimi JB bottom. Abana ofasika ma mesha Mr. Chubotom. Abano fasika efa ma mesha na kwami bottom. But abano should create an enabling environment for businesses to grow. Say the be abano betumi anya ne to e de afriso. But adia Ghana ni enya ho faso no. Ade tire say Ghana ni tua ho ka. Na ade ne kura na ye hwehwa ye hu. Tiyo Ghana sika no Covid-19 sika no ni ye de kokko rente ye no ya rente ye tua ka 30 million awie ye de 20 million akwa ye renovation and a remodeling or whatever they call it ye wie ya oh funny enough project Nankasa Crown has not been put into use but Ghana ni ya chairman say tia na wutua wi yeso ye de akwakoye den akutua ye bosia na ye de no. This is the Ghana we have. Ladies and gentlemen, I'm here to watch now. Now it is so funny and it's so terrible. Say ya ngine Ghana honi ya for Ghana say ye baby ya. This is the kind of result ye benya. Say ya ngine ya Ghana ne ho ne ya ma Ghana ni na hu say we have a certain Ghana ye benya ho faso dachi bia. Say ya na beba na eba wie ne agi ye ni so a na afia start say ye bobo ye hwene na refi say Or man yourself now has no relevance and has no significance to whatever you are doing.